What is the purpose of a patient package insert, PPI? A. Provide drug costs. B. List manufacturer contact. C. Educate patient on proper drug use. D. Substitute for pharmacist counseling. Answer: C. PPIs inform patients about safe and effective use of a medication, especially for drugs like estrogens or isotretinoin. Which of the following is an example of a therapeutic duplication? A. Lisinopril and hydrochlorothiazide. B. Ibuprofen and acetaminophen. C. Simvastatin and atorvastatin. D. Amoxicillin and azithromycin. Answer: C. Simvastatin and atorvastatin are both statins used for cholesterol lowering, which may lead to duplication. Pharmacy technicians are allowed to make therapeutic substitutions. A. True. B. False. Answer: B. Only pharmacists or prescribers can make therapeutic substitutions, not technicians. What form is used to order Schedule II controlled substances? A. DA Form 106. B. DA Form 41. C. DA Form 222. D. DA Form 224. Answer: C. DA Form 222 is specifically used to order Schedule II drugs. Which medication requires a risk evaluation and mitigation strategy, REMS? A. Lisinopril. B. Isotretinoin. C. Metformin. D. Omeprazole. Answer: B. Isotretinoin requires a REMS program I-pledge due to its teratogenic effects. Compounded medications are FDA approved. A. True. B. False. Answer: B. Compounded medications are not FDA approved because they are customized for individual patients. A prescription is written for amoxicillin 500 mg POTID times 10 days. How many capsules are needed? A. 20. B. 30. C. 15. D. 10. Answer: B. TID, 3 times a day, times 10 days equals 30 capsules. A patient brings a prescription for warfarin and asks to purchase OTC ibuprofen. What should the pharmacy technician do? A. Sell ibuprofen as requested. B. Recommend acetaminophen instead. C. Notify the pharmacist immediately. D. Ignore the interaction concern. Answer: C. Warfarin and ibuprofen can interact and increase bleeding risk. The pharmacist must be consulted. Which classification does omeprazole belong to? A. Proton pump inhibitor. B. H2 receptor antagonist. C. Antiemetic. D. Antacid. Answer: A. Omeprazole is a proton pump inhibitor, PPI, used to treat acid-related disorders. What is the beyond use date, BUD, for a non-sterile compound without stability data stored at room temperature? A. 14 days. B. 30 days. C. 6 months. D. 180 days. Answer: B. According to USP less than 795, if no data is available, the BUD is 30 days for non-aqueous formulations. Which auxiliary label should be used for metronidazole? A. Do not take with alcohol. B. Take with milk. C. May cause drowsiness. D. Take on an empty stomach. Answer: A. Alcohol should be avoided during and for at least 3 days after metronidazole therapy to avoid severe reaction. What is the purpose of a MedWatch form? A. Report drug shortages. B. Report adverse drug events. C. Track controlled substances. D. Submit prescription errors. Answer B. MedWatch is the FDA system for reporting adverse events and product problems. How often must a controlled substances inventory be conducted per DEA regulation? A. Monthly. B. Every 6 months. C. Annually. D. Every 2 years. Answer D. A biennial inventory is required for all controlled substances. What is the proper storage temperature range for refrigerated medications? A. -15 degrees Celsius to -25 degrees Celsius. B. 8 degrees Celsius to 15 degrees Celsius. C. 2 degrees Celsius to 8 degrees Celsius. D. 15 degrees Celsius to 30 degrees Celsius. Answer C. Refrigerated drugs should be stored between 2 degrees Celsius and 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. A medication labeled CII is categorized under which DA schedule? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer C. CII denotes Schedule 3 controlled substances, which have moderate to low potential for abuse. Which of the following medications is a beta blocker? A. Amlodipine. B. Losartan. C. Lisinopril. D. Metoprolol. Answer D. Metoprolol is a beta blocker used for hypertension and cardiac conditions. What must be included on a unit dose medication label? A. Prescriber's DA number. B. Manufacturer's name. C. Drug name, strength, lot number, expiration date. D. Patient's name and address. Answer C. A unit dose label must include the drug's name, strength, lot number, and expiration date. Which of the following medications requires a medication guide with each dispensing? A. Simvastatin. B. Isotretinoin. C. Prednisone. D. Furosemide. Answer B. Isotretinoin has serious risks and must be dispensed with a med guide under REMS. What is the generic name of Zyrtec? A. Loratadine. B. Diphenhydramine. C. Cetirizine. D. Fexofenadine. Answer C. Zyrtec is the brand name for cetirizine, a second-generation antihistamine. What is the maximum number of refills allowed on a Schedule 3 drug prescription? A. 5. B. 1. C. None. D. Unlimited. Answer A. Schedule 3V medications can be refilled up to 5 times within 6 months. In the Orange Book, what does AB rating indicate? A. Not bioequivalent. B. Brand only. C. Therapeutically equivalent. D. Controlled substance. Answer C. AB indicates a drug is therapeutically equivalent to the reference-listed drug. Which agency oversees the safety and efficacy of medications in the U.S.? A. OSHA. B. DEA. C. FDA. D. CDC. Answer C. The FDA is responsible for approving and regulating medications. What is a common side effect of ACE inhibitors like lisinopril? A. Constipation. B. Chronic cough. C. Rash. D. Hypoglycemia. Answer B. ACE inhibitors commonly cause a persistent dry cough. A Class 1 drug recall means A. Minor labeling error. B. Recalled for economic reasons. C. Risk of serious adverse health consequences or death. D. Slight risk of side effects. Answer: C. Class 1 recalls are the most serious, involving potential harm or death. Which dosage form bypasses the gastrointestinal tract? A. Capsule. B. Solution. C. Rectal suppository. D. Intravenous injection. Answer: D. Intravenous. 4. Administration bypasses the GI tract and enters directly into circulation. What schedule is alprazolam classified as? A. Schedule 2. B. Schedule 3. C. Schedule 4. D. Schedule 5. Answer: C. Alprazolam is a Schedule 4 controlled substance due to its abuse potential. What is the function of the NDC number? A. Insurance reimbursement. B. Identifies medication, manufacturer, and package size. C. Price comparison tool. D. Shipping identification. Answer: B. The National Drug Code, NDC, uniquely identifies the manufacturer, product, and packaging. A technician must check for drug-drug interactions when filling a prescription. What software is commonly used for this? A. REMS. B. DEA. C. OSHA. D. DUR. Answer: D. DUR, Drug Utilization Review, software checks for interactions and duplications. Which law created the distinction between prescription and OTC drugs? A. Food, Drug, and Cosmetic Act. B. Durham-Humphrey Amendment. C. Controlled Substances Act. D. Kefauver-Harris Amendment. Answer: B. The Durham-Humphrey Amendment established prescription versus OTC classifications. What is the correct way to dispose of fentanyl patches? A. Flush down the toilet. B. Throw in regular trash. C. Return to manufacturer. D. Dissolve in water. Answer: A. Due to potency, fentanyl patches are on the FDA flush list to prevent accidental exposure. What should a technician do if a prescription is missing the dosage form? A. Guess based on medication. B. Ask the patient to fill it in. C. Notify the pharmacist. D. Call insurance. Answer: C. The pharmacist must clarify any missing or unclear information on a prescription. Which auxiliary label should be placed on a prescription for metronidazole? A. Do not take with alcohol. B. Take with food. C. May cause drowsiness. D. Take on an empty stomach. Answer: A. Metronidazole can cause a severe disulfiram-like reaction when combined with alcohol. What is the maximum allowable schedule refill policy for Schedule 3 controlled substances? A. 0 refills. B. Up to 1 refill within 30 days. C. Up to 5 refills within 6 months. D. Unlimited refills within 12 months. Answer: C. Schedule 3V drugs may be refilled up to 5 times within 6 months of the original prescription date. Which of the following medications must be stored in its original container due to photosensitivity? A. Amoxicillin. B. Nitroglycerin. C. Metformin. D. Simvastatin. Answer: B. Nitroglycerin is highly sensitive to light and moisture and should remain in its original amber container. A technician receives a prescription for hydroxyzine but the prescriber's handwriting is unclear. Which step should be taken next? A. Guess the drug based on context. B. Ask the patient to choose. C. Substitute with cetirizine. D. Call the prescriber to clarify. Answer D. Any unclear prescriptions must be clarified directly with the prescriber to avoid errors. Which of the following is a high alert medication according to ISMP? A. Ibuprofen. B. Warfarin. C. Lisinopril. D. Metformin. Answer B. Warfarin is a high alert medication due to its narrow therapeutic index and risk of bleeding. All controlled substances require a DEA number for prescribing. A. True. B. False. Answer A. DEA numbers are mandatory for prescribers who issue prescriptions for controlled substances. Which of the following drugs is classified as a benzodiazepine? A. Sertraline. B. Diazepam. C. Propranolol. D. Zolpidem. Answer B. Diazepam is a benzodiazepine, a class of medications used primarily for anxiety and seizures. A laminar flow hood should be turned off every night to conserve power. A. True. B. False. Answer B. Laminar flow hoods should typically run continuously or be run for at least 30 minutes before use to ensure sterility. Which is the appropriate needle gauge for an intramuscular injection? A. 14 to 16 gauge. B. 30 to 32 gauge. C. 25 to 27 gauge. D. 18 to 23 gauge. Answer D. Intramuscular injections typically use needles in the 18 to 23 gauge range. Which federal act created the distinction between prescription and over-the-counter drugs? A. Controlled Substances Act. B. Durham-Humphrey Amendment. C. Kefauver-Harris Amendment. D. Food, Drug, and Cosmetic Act. Answer B. The Durham-Humphrey Amendment, 1951, established the legal distinction between prescription and OTC drugs. What is the main concern when filling prescriptions for lookalike/soundalike drugs? A. Pricing differences. B. Expiration dates. C. Dispensing errors. D. Insurance rejection. Answer C. Loss of drugs increase the risk of medication errors due to confusion in names. Which law requires tamper-resistant packaging for certain over-the-counter medications? A. Poison Prevention Packaging Act. B. Federal Food, Drug, and Cosmetic Act. C. Prescription Drug Marketing Act. D. Federal Anti-Tampering Act. Answer D. The Federal Anti-Tampering Act was passed in 1983 after product tampering incidents. Sublingual tablets should be swallowed whole. A. True. B. False. Answer B. Sublingual tablets are meant to dissolve under the tongue for faster absorption. What term refers to a list of medications approved for use within a hospital or health system? A. Prescription log. B. Inventory list. C. Formulary. D. MAR. Answer C. A formulary is a list of medications that are approved for use in a specific facility. A red C stamp is used to denote what? A. Refrigerated items. B. Controlled Substances Schedule 2. C. Controlled Substances Schedule 3V. D. Hazardous waste drugs. Answer C. The red C indicates that a drug is a Schedule 3V controlled substance. Reconstituted antibiotics must be shaken well before each use. A. True. B. False. Answer A. Shaking ensures even distribution of the drug in the suspension. Which type of drug recall is most serious and involves products that may cause serious harm or death? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer A. Class 1 recalls are issued for products with a reasonable probability of serious adverse health consequences. Which DEA form must be completed to order Schedule II controlled substances? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer C. DEA Form 222 is required for the ordering, transferring, or returning of Schedule II drugs. What is the minimum education requirement to sit for the NHA ExCPT exam? A. Doctorate in Pharmacy. B. High school diploma or equivalent. C. Bachelor's degree. D. State certification. Answer B. The NHA requires candidates to have at least a high school diploma or GED to qualify for the ExCPT.